disadvantages. Yes, recording. As you know, Sicily and Italy are separated by the little piece of sea, is Messina Sea. And since, I don't know, maybe 1950, we try to build a bridge between the two areas, the two regions. But sometimes politically, the green or the extremity left try to put the disadvantage in order to don't build the bridge. But I don't know the disadvantage for who are. Maybe for the bird that cannot fly better, maybe for the fish that don't swim inside the sea very well. I don't know, but everybody know that the bridge is a solution, because people from Sicily can get the north of Italy more easily. So everything has disadvantages, and we are going to talk about which tool now is better to get the best arterial tourniquet for orthopedic surgery. Is our elastic disposable tourniquet or the pneumatic tourniquet? Maybe both are advantages and disadvantages. Let's go to introduce, because all are the same contraindication. By patients with poor peripheral blood flow, edema, or deep vein thrombosis are maybe we have to take care of this kind of patients. If the limb is infected or with malignancy, do not apply directly on the skin that is fragile or significant lesion, maybe dermatologic pathology. So is for fragile skin is using a sterile lace bandage is much better. Do not leave on patient's limb for more than 2 hours. We know, but sometimes we can go over. And do not place directly over a ulnar nerve in the elbow or peroneal nerve at the proximal tibia. Traditional tourniquet is a modern pneumatic tourniquet consists of 3 basic components. As you know, a cuff that is similar to a blood pressure cuff and is wrapped around the patient's limb or arm, a compressed gas source, a mechanism with a pressure gauge that is designed to maintain pressure in a cuff at set value. Maybe is around 300 millimeter of mercury on the leg, maybe less on the arm. The tourniquet is placed around the thigh or around the arm, below the knee or in upper limb. The limb is elevated. Sometimes we use to an ESMAR compression wrap to in the cephalic direction to expelling the venous blood. And the tourniquet is inflated to a pressure about 250, maybe more in the leg, or 100 millimeters of mercury above systolic pressure. Limit ischemia advantage of this kind of solution. The pressure is just in advance before insufflation. Is a self-compensation, keeping the cuff pressure constant during the limb movement, maybe, and for the limb size changes. Is the possibility to inflate and deflate during the procedure. The tourniquet is an advantage, and see the duration of the ischemia under control because we have the device with the time that is going on. But there are disadvantages. What is not a sterile device? And this is very important. We are going to see in the next slide the pictures that let see how close sometimes is the tourniquet to the surgery field. It's not a sterile device. The deleterious effect of tourniquet inflation include pain, is called tourniquet pain. Sometimes we see at the end of the procedure an hematoma in the region of the tourniquet. Metabolic and hemodynamic changes that occur during tourniquet inflation and deflation. Damage to blood vessels and muscle if the tourniquet is inflated in excessive periods, skin injury, and tourniquet-induced nerve damage, neuroapraxia with a pneumatic cuff tourniquet. Sometimes the pneumatic tourniquet applies a uniform pressure all over the area under the cuff in the limb. The pressure is either in the surface and 40% lower in the center of the limb. In these studies, you can see how in many papers, the studies are the effect of non-sterile tourniquet are in the surgery field. Tourniquet contamination is a risk factor in the development of surgical infection. Is recommended to clean the tourniquet before every procedure, but not always is possible because the tourniquet is difficult to clean every time because of the OR is going on many times. And the infection in the tourniquet is a resistant organism. Is present in the orthopedic theater and may possible to be a source of surgical site infection. In this picture, you can see the tourniquet and the device where you can see the time, you can see the pressure, and so you can check. But in this picture on the right, see how close is the tourniquet, the cuff, to the surgery field on the knee in this case. It is a problem many times, also not only for the infection, but also to move the knee in the right way. So when we are talking about the narrow elastic disposable tourniquet, is a sterile exsanguinating occlusion device, is providing up 95% of exsanguination for blood removal. And this is very easy to use because consists of a sterile single-use elastic in silicone ring wrapped in a stockinette and two pulling straps with handles. Sometimes are 4 straps in handles for the black and white, for the biggest. It can be used without a power supply or a compressed ice source. How it works? The surgeon places it on the patient's finger if we are do an arm surgery, or toes in a foot surgery, and pull the wrap, and the ring is going on the arm or on the leg. The ring exerts pressure, performing that exsanguinating, so blood removal function, quickly and effectively. Stockinette unrolls and the limbs at the occlusion location, providing an instant sterile drop over the surgical field. It's important to put the ring in the right position, not as we say before, close to the ulnar nerve on the elbow or the sciaticus popliteal, the peroneal nerve on the knee. The blue position are the optimal one on the arms or on the legs. And we can choose the right measure using simple meters in the and we can choose the right size of the device. Which one are the advantages? Is a superior exsanguination. The rolling action of the occlusive silicone ring can provide 95% of blood out of the limb, opposed to 67% with a HemaClear bundle, when 45% when a limb elevation method is used. It can use a sterile field. You can put the sterile surgery field and then put the device in a sterile single use that eliminates the possible contamination and so the infection, reducing the risk of infection. Increase access to the surgical field, the narrow profile and the small footprint facilities, a larger and more accessible surgical field. Simple and cost effective. So this is maybe a point. In Sicily, the cost is very low. Maybe in Holland or in Germany is more expensive because you have more possibility. I don't know, I'm joking. See, it's a simple and cost effective, is easy to apply and to reduce the preparation time and eliminates the need of tourniquet machine, contaminate the resorbable cuff and HemaClear bandages, and reduce post-operative complication, reduce the risk of post-operative complication like deep venous thrombosis, pulmonary embolism infection, excessive blood loss, all the possible advantage of the tourniquet. You cannot choose the pressure, but when choosing the right model, you have a guarantee to have an optimal pressure, enough for blocking the blooding and not strong enough to cause pain and nerve damage. As you can see, there are a lot of colors. Every colors have a length and a size for arm, for limb, and is very easy to use. No skin injury, diminish tourniquet pain and the nerve damage. The pressure with this kind of device is either in the surface and 40% lower in the center of the limb. In this picture is a difference between the multi-use device with the HemaClear that is a single-use device. This is important for the sterility of the surgical field. There are disadvantages. Which one? It is impossible to have a gradual release because when you finish or during your procedure, you have to cut the ring in silicone and the device is finished to have its activity. The pressure on the skin is comparable to the pneumatic tourniquet at approximately 200 to 250 millimeters of mercury for the upper limbs and 300 to 350 for lower limbs, but it's not possible to establish a specific blood pressure value. Also in the normal tourniquet, we used to have a single pressure. Is difficult that we are choosing the pressure in base of the level of the pressure in that moment. So maybe it's the same. Is inability to deflate and insufflate. If the surgery sometimes is during more than 2 hours or more than 1 hour and a half, sometimes you can use it to deflate and then insufflate again, or during a total knee replacement, sometimes when you have to put the cement, some surgeon used to deflate and then inflate again after the blood control. You don't have any visual temporal reference during surgery, and you have, of course, an extra cost because when you use the traditional tourniquet, you buy it one time. Maybe I don't know exactly how is the cost, but I think is expensive. In this case, you have to buy every time a new device, but the cost, of course, is less. This is my experience directly. As you can see, you put the drop and the silicone ring. After this, you have to cover the HemaClear with a new sterile trap. You see the green one, because when you cut the silicone ring, the surgery field has to be sterile. In this case, you see how useful is the silicone ring. Is very close to the knee surgery field on the right with a normal tourniquet. And this is far from the knee in the left. And this is important to move the knee in the right, in the better position, in the that you like, and also for the infection, as we said before. Some kind of literature that show how higher is the rate of wound complication using the pneumatic tourniquet, and the advantage being applied in sterile condition is much better to the normal one. Again, the use of a disposable tourniquet has better outcome than a conventional tourniquet with minimal or no local complication. And the average operative field space increase using a sterile single-use tourniquet compared to a multi-use pneumatic. It is recommended that sterile single-use tourniquets are safe and are useful tool for surgeon facilitating ease of revision. So in the end, everything are advantage and disadvantage, but for me, using this kind of device is very useful and very easy. Thanks a lot.
Ah, bravo, bravo. You are a natural teacher.
Dr. Russo, thank you very, very much for preparing this and for sharing I think it's very interesting to see how every different doctor will find a different focus on his choice. And I like very much your approach on this building the bridge.
Thanks.
So I appreciate all of you having your time. I don't know, Noam, if you want to say any closing remarks.
Maybe first of all, thank you so much, and it was really very well put together. We have there have been more than 1.8 million operations done with HemaClear around the world in the last 15 years. And over time, we learned many things, mostly from questions from surgeons, from nurses, anesthesiologists, etc. And we continue to learn. There are things that we still don't understand. For example, well, we do understand, but only recently, that putting HemaClear all the way up to the groin eliminates tourniquet pain.
Yep.
That was a discovery that we made just a few years ago with the help of a French anesthesiologist, Dr. Estebe, who really didn't know that he's helping us, but he was brave enough to have an MRI with the pneumatic tourniquet arm, and that taught us so much about what happens beneath the tourniquet. And after we saw those images, we realized that HemaClear has to be put away from the muscle. But there's one thing that keeps puzzling me, and that is the issue of DVT, post-operative DVT. We know from different studies, from different papers, that DVT goes down by 60 or 70% when HemaClear is used. And I don't want to go into all the details, but I don't understand why. The tourniquet is up near the groin. The DVT develops near the ankles, near the lower leg, how it is related. So we know a lot, but there are still questions. We're still learning. I hope it will not take us 100 years like it took with the pneumatic tourniquets, but it's a cardiovascular product in the hands of the orthopedic surgeon. So it is our job to learn and to teach everyone about this product.
I think that many times you don't know if the DVT is going to be, because not to all the patients you check this kind of disease after surgery. So the percentage could be more. In this case, I think that the key point is the facility, is the easily way to use this kind of device compared to the traditional tourniquet in some kind of surgery is unbelievable. For example, for the knee prosthesis.
Yeah,
in Italy, we drink a red wine during the talking. Okay, friends,
yeah,
red wine. I don't know.
In Israel, we drink the wine during surgery. No.
Not during surgery, no. But talking is very, very good to do it.
That's wonderful.
Salute.
Yeah, I'm really looking forward to visit Sicily and meet you
Yeah,
in
of
person,
course.
and maybe we can drink some wine together. But thank you so much for.
I'm looking forward to see you in Sicily because cultural exchange for me is the base of my life. And know you and all of you, for me, is a lucky. And I hope to see you as soon as you can.
Dr. Russo, thank you
Wonderful.
very, very much.
Yeah, Sharon, can you just list the countries that are on the screen quickly?
Of course, we have here Slovenia, Austria, Greece, USA, Italy, Serbia, France, and Latin America. We have someone from Latin America here.
And
Portugal. And am I missing someone?
yeah, Israel.
Israel.
Of course. Well, thank you, everyone. It's a pleasure to meet you.
Thank you, guys.
Thank
And
you
see you
very
back
much.
again. Thanks.
Uh,
Bye-bye.
Bye.
Bye-bye.
Bye.
Yeah, Sasha, thank you. You did a great job.